Hello and welcome to this lecture on nutrition during breastfeeding. In this next part, what we're going to do is to focus on some of the nutritional concepts about breast milk in particular, but then also about the mother's dietary needs during the period of breastfeeding. So we are all operating in this course and in this particular lecture under the assumption that human milk is the best food for a newborn infant for the first year of life or longer, with most international and domestic health associations recommending exclusive breastfeeding for the first 6 months of life. And then when the child is developmentally ready, with the introduction of weaning foods, but with the continuation of breastfeeding if at all possible. Now, the mom's diet doesn't necessarily alter the macronutrient or the major mineral composition of the breast milk that she creates. However, it does change to some degree the fatty acid profile and the amounts of some vitamins and some trace minerals. So we can't say that what a mom eats doesn't matter. You'll see that to some degree it does, but not for the major minerals and not for the macronutrients. If a mom's diet is inadequate, she still does produce high quality breast milk. The quality of her breast milk will be preserved at the expense of the quantity of milk. And so of course malnutrition in the mother is not desirable in the sense that it can result in underproduction of high-quality milk. So there are many contributing factors to breastfeeding rates, and we're not here in this lecture to talk about those. The focus rather is going to be on the nutritional concepts once someone has assumed breastfeeding. Breast milk production is referred to as lactogenesis, which if you break down that word is the creation of milk. Lactogenesis occurs in 3 stages. The first stage, lactogenesis 1, is characterized by the beginning of the formation of milk. The lactose and the protein content begin to increase, and lactogenesis 1 takes place during the first few days postpartum. In the second period of lactogenesis 2, this is what sets in about 2 to 5 days postpartum, and it's marked by an increased blood supply and blood flow to the mammary glands. This is sometimes referred to as the period when a new mother's milk comes in. Changes in the milk composition and the quantity of milk produced are pretty drastic between stages 1 and stage 2. Lactogenesis stage 3 sets in usually about 10 days postpartum. This is the state in which the milk composition, for the most part, stabilizes. There are 2 primary hormones that are important to be aware of, although there are many more hormonal contributors to breast milk production than mentioned here. We're just going to focus on the 2 major ones, which are prolactin and oxytocin. So prolactin is responsible for the stimulation of milk production. The act of suckling by the baby doubles the prolactin levels in the mother. Other things like stress, sleep, sex may also stimulate prolactin. There is something called prolactin inhibiting factor that's released by the hypothalamus that prevents prolactin production during the end of pregnancy. And in some women who have disruptions in their hypothyroid or in their thyroid gland, that might have a negative impact on their prolactin production. Oxytocin, on the other hand, is stimulated by the suckling or nipple stimulation. Not the other hand, it's basically the same. The main role, though, for oxytocin is different than prolactin. Whereas prolactin stimulates the milk production, oxytocin is responsible for letdown, which is the ejection of milk from the milk glands into the ducts. Oxytocin also acts on the uterus, causing it to contract, seal blood vessels, and shrink in size following birth, which is what we want. The infant suckling at the breast stimulates the pituitary to release the hormones prolactin and oxytocin. So you see in this image here that both hormones act on the mammary glands. Prolactin is responsible for stimulating milk production, whereas oxytocin stimulates ejection of milk. Both hormones act on the reproductive organs in that prolactin inhibits ovulation and oxytocin promotes uterine contractions. Colostrum is referred to as the name of the first milk, which is yellowish in hue, produced during the phase lactogenesis 2. Colostrum is extremely important for a variety of nutritional and immune-enhancing standpoints. Colostrum is measurable in teaspoons versus ounces, and we'll get to that next, but a very, very small amount of colostrum is actually required or even produced by the body. Colostrum is higher in protein and lower in fat than is mature milk. and it's extremely valuable from a nutritional standpoint and an immune standpoint in that it is very rich in protein and immune factors. There are also higher concentrations of sodium, potassium, and chloride than does more mature milk have. Now, sometimes a new mom will wonder, is colostrum really enough for my baby? As it seems unusual that this full-term healthy infant would only need a teaspoon or two of fluid in the first few days of life. And the answer is that colostrum is the only food that a healthy full-term baby needs in its initial days of life. Milk production will meet demands. And when educating moms about this, one of the easiest ways to convey this concept is to focus on the size of the baby's stomach. Okay, the size of the stomach of a 1-day-old baby can only accommodate 5 to 7 milliliters. Okay, there's 30 mils in an ounce. So think about that, somewhere between a sixth to a fifth of an ounce. And basically on day 1, that baby's stomach is really only the size of a marble. A 1-day-old baby his or her stomach cannot stretch to accommodate more colostrum. So the colostrum is plenty for this baby at that stage. By day 3, the baby's stomach is increased slightly to the size of a shooter marble, okay, getting upwards to being able to accommodate about 1 ounce. And then by day 7, which is for most women after the time when their milk has come in and they're starting to produce more mature human milk, the size of the baby's stomach has expanded to about the size of a ping pong ball, which is about 1.5 to 2 ounces. Many new moms also often wonder if they're feeding their baby frequently enough or too frequently. As an educator, it's important to convey the fact that it's almost impossible to feed your baby too often. Okay? The goal is to aim to nurse somewhere between 10 to 12 times during a 24-hour period for the first week, and then somewhere between 8 to 12 times for weeks 2 to 6. Some moms will be closer to 8, although others will be at the upper end of the range, 12 or even more times per day. It is advisable to encourage new moms to nurse at the first signs of hunger. Okay? Don't wait until the baby is crying. When the baby is exhibiting signs of hunger, like stirring, rooting, or putting his hands in the mouth, that is an indicator that the baby is hungry. Mothers should be encouraged to allow unlimited time at the breast when the baby is actively sucking, keeping in mind that there are some excessively sleepy newborns who may need to be woken up to nurse every 2 hours during the day or every 4 hours at night. So how do you know if the baby is getting enough milk? This is a primary concern for new nursing mothers. With regards to weight gain, it is normal for newborns to lose up to 7% of their birth weight in the first few days. After the mom's milk comes in, an average healthy full-term breastfeeding baby will gain about 6 ounces per week, which is the equivalent of 170 grams per week. There may be periods where cluster nursing is going to be required, usually within weeks 2 to 6. And cluster nursing is defined as very frequent to almost constant nursing. Cluster nursing is sometimes correlated with growth spurts, and growth spurts in the early weeks, although they vary from baby to baby, may occur at somewhere between 7 to 10 days, 2 to 3 weeks, and then again at the 4 to week period. Counting wet and dirty diapers is another helpful tool for parents to determine whether or not they're giving their kids enough breast milk. In week 1, with regards to dirty diapers, there should be 1 dirty diaper for each day of life in the early days. After day 4, the stools should be yellow, and the baby should have about 3 to 4 stools per day that are about the size of a U.S. quarter or larger. As far as wet diapers go, adequately breastfed babies can expect to have about 1 wet diaper for each day of life in the early days. So on day 1, 1, on day 2, 2 diapers, on day 3, 3 wet diapers, and so on. After the mom milk comes in, however, most babies will have about 5 to 6 wet diapers in a 24-hour period. In weeks 2 to 6, it changes a little bit. As far as dirty diapers go, you can expect 3 to 4 or more stools per day, about the size of a quarter. Now, the normal stool of a breastfed baby is going to be loose, usually soft to runny, and it may be seedy or curdy. After 4 to 6 weeks, the baby may stool less frequently. It could even be as infrequent as every 7 to 10 days, which if the baby is gaining weight well, the American Academy of Pediatrics and other bodies would say that's perfectly fine. Again, the key there if you're going that long between stool is that if the weight is being gained appropriately. As far as wet diapers go in weeks 2 to 6, you can expect to get 5 to 6 wet diapers in a 24-hour period. And after 6 weeks, that might drop to 4 to 5 a day. But at that point, the capacity and the amount of volume excreted as far as urine goes will increase slightly. As far as calories go in breast milk, there's about 0.65 calories per ml of breast milk. Now, this will vary throughout the feeding due to composition changes in breast milk. But breastfed infants, for the most part, we say that they consume fewer calories than formula-fed infants. Now, why is there this discrepancy in calorie intake? It might have to do with the composition of human milk, which is different and oftentimes less per ml than you would find in formula. It may have to do also with the inability to see the volume of breast milk. Sometimes a frustration for new nursing moms is they say, I can't quantify exactly how much I'm feeding because I can't see it. And it may also have to do with differences in the baby suckling at the breast versus the nipple. Breastfed infants, data suggests, are thinner at the 8 to 11 month point by weight than the formula-fed babies are. But the differences in weight will disappear by somewhere between 12 to 23 months of age and are certainly not noticeable by age 5. A little bit more about the composition of breast milk, starting with fat. Breast milk is very high in fat. About half of the energy or half of the calories in breast milk comes from fat. Breast milk tends to be lower in fat at the beginning of a feeding, the milk known as foremilk, and higher at the end, which is the milk known as hindmilk, although there are certainly some disagreements as to just how much the consistency of the breast milk changes throughout the feeding. Breast milk is also a good source of DHA. DHA is an essential fatty acid that is important for retinal development, and DHA accumulates at the end of pregnancy, and it promotes cognitive development in that baby as well. As far as protein goes, protein content is relatively low compared to cow's milk. The major type of protein in breast milk is called casein, and casein is a wonderful protein that is very easily digested by that newborn baby. Okay, it's very difficult for a baby, it's almost impossible for a baby to digest the types of protein you would find in cow's milk. Okay, it's too difficult on the kidneys. But the casein in the breast milk is perfectly formulated for that baby's kidneys. As far as carbohydrates go, there are two that we're going to look at. First, lactose. Lactose is the dominant carbohydrate in breast milk. And lactose is important because that's also very easily absorbed by the newborn baby's GI tract, and it helps to enhance calcium absorption. Breast milk is also rich in oligosaccharides. And oligosaccharides are medium-length carbohydrates that constitute the second largest type of carbohydrates in breast milk. They stimulate the growth of good bacteria and hinder the growth of harmful bacteria. People often ask about vitamin and mineral supplementation, and do breastfed babies need to take vitamins or minerals? And the answer is, according to the American Academy of Pediatrics, that vitamin and mineral supplements are not necessary for healthy, full-term breastfeeding babies during their first year of life. Most vitamins, waters, juices, formula, and even solids are not beneficial for healthy, full-term breastfeeding babies during the first 6 months, and they may actually prove harmful. Again, the primary recommendation is exclusive breastfeeding for the first 6 months of life. The American Academy of Pediatrics recommends a number of specific things with regards to vitamins and minerals. They do recommend a vitamin K injection for the baby born soon after birth. That's in order to prevent hemorrhagic disease, or in the case of hemorrhagic disease. They do recommend routine vitamin D supplementation at a level of 400 international units per day for exclusively breastfed babies, beginning as soon as the baby gets home from the hospital or shortly after birth. And that's in order to prevent against rickets. The American Academy of Pediatrics also recommends no fluoride supplementation for the first 6 months of life. And then from 6 months to 3 years, fluoride supplementation may be indicated depending upon the municipal water supply. So if it is not a fluoridated water supply, then you would want to look up the AAP recommendations for fluoride supplementation. Although most municipal areas now do have fluoridated water. In this slide, we're going to look a little bit about how breast milk differs from infant formula and differs from cow's milk. Now, the goal of infant formula or infant formula manufacturers would want you to believe that infant formula is nutritionally identical to breast milk. From a macro and micronutrient standpoint, in many ways, infant formula is very similar, although breast milk is always a more superior and more preferred type of feeding for babies because it is optimized as perfect nutrition for a newborn infant. The primary difference, and the thing that infant formula manufacturers can never replicate, is the reality that breast milk is rich in colostrum and immune factors that are also called antibody factors. These enhance health, they promote immune function, and they help prevent against many, many other types of conditions and diseases, and infant formula cannot or has not been able to replicate those factors found in breast milk. When it comes to carbohydrate, fat, and protein, infant formula and breast milk are pretty similar. The primary carbohydrate, as we've learned, is lactose. Breast milk is very high in fat. About 55% of the calories come from fat, and that's extremely important because in that first year of life, the baby's brain is still developing, and a high-fat diet promotes optimal brain development. As far as protein, breast milk has the perfect blend of whey and casein proteins that's easy for the baby to digest. Now, infant formula can, to some degree, replicate that, but cow's milk is certainly inappropriate for a baby under the age of 1 because it's too high in protein and it's just too challenging for the kidneys to digest. It also actually has too much casein. As far as iron goes, breast milk is not a very high iron food source, but that's okay. There's a little bit of iron in breast milk, but it doesn't really matter because for a full-term baby, they have received an iron transfer from the mother at the end of pregnancy that should last that baby for about the first 6 months of life. Formulas, on the other hand, tend to be iron fortified. So they might have a little bit more quote-unquote nutrition with regards to iron, but most full-term babies don't need supplemental iron. Vitamin D, breast milk is also not a rich source of vitamin D. Now, depending upon how often the mom takes the baby out into the sun may affect that baby's vitamin D levels. But again, the American Academy of Pediatrics does recommend 400 international units per day of supplemental vitamin D for infants who are exclusively breastfed, beginning within the first few days of life. Formula, some of them are fortified with vitamin D. And cow's milk is always fortified with vitamin D in the United States, although cow's milk, again, is not appropriate for a newborn infant for a number of other digestive and nutrition reasons. As far as calcium goes, the calcium in breast milk is well absorbed by the infant, yet the calcium that you would find in cow's milk, the loads are too high for that newborn baby's kidneys to handle, and so another reason why cow's milk is not appropriate. If you want to compare breast milk to a recommended adult diet, the primary difference you'll note is see how much higher in fat the diet or the breast milk is compared to an adult diet. We generally say a heart-healthy diet is one that has less than 30% of calories from fat for adults, but see how breast milk is 55% of the calories from fat. Again, that is beneficial for the brain development. You may also notice that the yellow bar, the protein, breast milk is very low in protein, and that's by design, whereas the typical adult diet is much higher in protein. What are the benefits of breastfeeding? Well, we can quantify the benefits of breastfeeding or strategize, put them in categories based upon immediate or long-term benefits. In the immediate, at the very beginning, that colostrum, that first teaspoon of fluid that comes out of a mother's breast is extremely nutritious, to the point where it's sometimes referred to as liquid gold. Colostrum contains many bioactive factors, things like enzymes, hormones, immune, and growth factors that are also present in mature milk, but in very, very concentrated amounts in the colostrum. Children who are breastfed tend to have less food allergy rates, less ear infections, less diarrhea, urinary tract infections, and pneumonia. In the immediate stages, the composition of breast milk changes somewhat to meet the baby's needs during the feeding. Again, there are more antibodies and over 45 bioactive factors in breast milk that cannot be replicated in formula. And also, exclusive breastfeeding prevents ovulation and acts as a built-in form of birth control if exclusively breastfeeding for the first 6 months. And that, of course, doesn't happen in all situations. There are some women who have reported return of ovulation, menstruation, or even get pregnant while exclusively breastfeeding, although more often than not, if you are exclusively breastfeeding, there's about a 6-month period for that first 6 months, if you are exclusively breastfeeding, where your body basically perceives that it's a natural form of birth control, I guess is another way to say that. In the long term, there's benefits for breastfeeding for both the infant and for the mom. Infants have lower rates of later on in life having type 2 diabetes, Crohn's disease, certain types of cancer, as well as allergies and neurological disabilities. The minerals and the peptides that are present in breast milk lead to lower blood pressure rates. There's also lower risk of adult ischemic disease, which is heart disease. There is some questionable data. It's not a generally agreed upon consensus, but some data does suggest that breastfed children have better cognitive development than do formula-fed children. Again, although the jury is kind of out on that definitively. For the mom, benefits include lower rates of breast and ovarian cancer. Breastfeeding helps protect bone density, so there's lower risk of osteoporosis. In people who have gestational diabetes during pregnancy, breastfeeding helps improve blood glucose levels. And that's important because if you had gestational diabetes during pregnancy, that same mom is at higher risk for developing regular type 2 diabetes following a pregnancy. Breastfeeding, of course, saves money as compared to formula feeding. You can actually look up online approximately how much per year you would save. I think it's somewhere between $2,000 to $3,000 in the first year if you breastfeed versus formula feed. And there's also some nice benefits now with the Affordable Care Act in the United States, where there's a mandate as far as the provision of an electric pump. If you are covered, that you do have access, your insurance needs to provide a pump, which is a huge barrier for some women. Not having access to expensive pumps in the past had been a barrier that hopefully now will be somewhat reduced or removed. And then, of course, one of the most cited reasons why moms like to breastfeed outside of providing perfect nutrition for the babies is that breastfeeding does help the mom return to her pre-pregnancy weight more quickly than if she were to formula feed. So what about the mom's diet during the period of breastfeeding? The mom's diet does change or should change because in order to support the lactogenesis, the mom does actually have higher energy, which are calorie needs, higher folate needs, and higher needs of the vitamins A, C, E, and riboflavin. Now, there's some discrepancy as to exactly how many calories a mom, quote-unquote, burns while producing milk. Milk production requires, on average, about 750 to 800 calories per day. But because most women are trying to lose excess weight in the postpartum state, most recommendations are that you should eat about 500 calories above baseline so that you're eating enough to produce adequate milk, but also that you're running a little bit of a calorie deficit to help you shed some of that excess weight. Hydration is important. Breast milk is made up primarily of water, and although you read in some references that a mom's hydration status doesn't affect her fluid or her breast milk production, from an anecdotal standpoint, many women will tell you that when they're well hydrated, they produce more breast milk. So it doesn't hurt to be well hydrated. Caution should be taken with regards to alcohol, nicotine, and the intake of mercury-containing fish. Caffeine, a general rule of thumb, is less than the equivalent of 2 cups of coffee a day is okay if you do drink coffee. Lactation can, however, double the daily calcium loss for the mom. So it's important to make sure that you're taking either still your prenatal vitamin or calcium supplement with vitamin D in the event that you're not a huge milk or cheese or dairy eater. So when is breastfeeding contraindicated? Okay, contraindications for breastfeeding in the developed world are actually very rare. Okay, there's a couple of disease states such as galactosemia or PKU, in which the mom should not breastfeed. In the developed world, if a mother is HIV positive, there are alternatives for feeding the baby, and so some recommendations say that women should not breastfeed. However, in the developing world, guidelines have changed recently in recent years with the advent of an increased proliferation of antiretroviral therapies. You would want to look up, for example, the World Health Organization guidelines for breastfeeding promotion in the context of HIV. And you'll see that actually more often than not, it is encouraged to breastfeed because there are no alternatives, and that breastfeeding exclusively may help lower the likelihood of transmitting HIV from the mom to the baby. If the mom has active, untreated tuberculosis or herpes lesions on her breast, she should not breastfeed, although she can express or pump that breast milk and feed it to the baby, because those disease compounds do not transmit in the breast milk. It would just be the actual act of breastfeeding that would be dangerous in that regard. With illicit drug use and alcohol, caution should be taken. You can look at the American Academy of Pediatrics has guidelines for the use or what to do in the case of illicit drug use or alcohol consumption. And we'll look closely at alcohol in a moment. There are certain types of chemotherapy and radiation therapies for cancer that may be contraindicated with breastfeeding. And for additional listed medications, you would want to look up the LactMed resource. Okay, and the URL is there for you. It's published in the National Libraries of Medicine by the NIH, and it's the largest online database of evidence-based recommendations about the use of medications during lactation. Looking a little bit more closely at breastfeeding and alcohol, okay, the general rule of thumb from many organizations is that if you're sober enough to drive, then it's okay to breastfeed. Now, that may mean a number of different things to different women depending upon their habitual or usual alcohol intakes. So to quantify it, the American Academy of Pediatrics recommends no more than 0.5 grams of alcohol per kilogram of body weight. And since we don't usually measure the amount of alcohol that we eat in grams, just to give you a ballpark idea, for a 60-kilogram mother, which is about 132 pounds, that means she should have no more than 2 ounces of liquor, 8 ounces of wine, or 2 beers. Nursing should, according to the AAP, take place 2 hours or longer after alcohol intake in order to minimize its concentration in ingested milk. Alcohol is, of course, not desirable for infants in the sense that it may negatively affect their motor development skills, and also alcohol can blunt prolactin response to suckling, so it can actually reduce supply. And many women will anecdotally tell you that. I notice if I have a glass of wine that my milk supply goes down. As far as smoking goes, maternal smoking, you may be surprised to learn, is not an absolute contraindication for breastfeeding. But of course, maternal smoking should be strongly discouraged, as it is associated with an increased incidence of infant respiratory allergy, sudden infant death syndrome or SIDS, low milk supply, and poor infant weight gain. Women should also be counseled to avoid smoking in the presence of the infant in order to minimize the negative effect of secondary passive smoke inhalation by the infant. So what about barriers to breastfeeding? If breastfeeding is so perfect and so wonderful and breast milk is so incredibly nutritious, then why doesn't every new mother breastfeed? Okay. There are a number of different barriers, many of which we don't have time in the context of a class of this nature to get into, but as an educator and a healthcare practitioner, it is important to be aware that many times the barriers to breastfeeding have to do with misunderstanding and many times even misinformation. That may be from particular family members or within certain cultural groups, and it is your job as an educator to be promoting evidence-based guidelines to help promote breastfeeding. Some women find that returning to work can be a barrier, as well as the reality that breastfeeding is not only frustrating, but also can be extremely time-consuming. As an educator, in order to encourage breastfeeding, it's important to keep in mind that self-esteem is key. You want to provide positive feedback and support. And for some tips on how to do that, I recommend the La Leche League International's breastfeeding guide in the URL you can see there. You should also inform women about the reality about barriers, okay, discussing barriers that he or she may be experiencing, and then informing the women of her right. Okay, and there's a couple of resources for you here. La Leche League has some information about breastfeeding in the law. And you can also look up the laws on breastfeeding in your state at breastfeedinglaw.com. You do want to, however, convey to all women who are considering breastfeeding that breastfeeding does not spoil the baby, it does not lead to picky eating, and certainly that infant formula is not nutritionally superior to breast milk. Because depending upon the type of information that mom may have received, she may believe that. A few more breastfeeding resources are available for you here. I encourage you to check out WellStart International. They have self-management, self-study modules, lactation management self-study modules. The National Alliance for Breastfeeding Advocacy, Kelly Mom Parenting and Breastfeeding page at kellymom.com. Baby Friendly USA to learn a little bit more about baby-friendly hospital policies, okay, which prevents the distribution of free samples of formula. La Leche League International, and then there are also resources on the ChooseMyPlate.gov website for pregnant and breastfeeding women. And on that site, you can make individual meal plans and learn a little bit more about food groups to help plan a healthy diet during pregnancy and breastfeeding. So with that, we conclude this lecture on nutrition during breastfeeding.